is for young key population members who have been advocating in their countries under the We Belong Africa umbrella.
To ensure that state institutions and government decision makers recognize, promote and protect the HIV and SRHR related rights of young key populations.
Having a program that supports your progress, that supports your advocacy, that supports you and wants to make you visible around the work that you do and give you the support and the tools, to be able to advocate is one of those things that I feel like we need such programs.
When I began a lot of this work, some of the pressing issues that were around SRHR and just lack of awareness on SRHR issues themselves. These are things that were not spoken about.
There were news articles at some point that were tying climate change to homosexuality and things like that. So you see a lot of the stigma and discrimination go so deep. It's touching so many other advocacy issues.
There was a lot of human rights violations of young key populations and LGBTQI persons. They were violated by law enforcement, they will be violated by their families, they will be violated as well by service providers in the health sector.
Depois tinha as outras áreas, que é a educação, o acesso ao emprego, em que as pessoas LGBTQI+ não tinham acesso, não eram aceitas sendo quem elas eram.
Tínhamos pouca participação nos espaços de decisão. E havia também pouco empoderamento das próprias populações-chave para ocuparem esses espaços.
Young key population deserve and should be at the forefront of advocating for their own sexual reproductive health and rights, services, generally everything that accords to young key populations. They are the people that are walking daily in these shoes, and young key population is a personal issue, and therefore it should be addressed by those that are really going through these issues.
Quando começamos a fazer a advocacia em prol das populações-chave, começamos a ter acessos a espaços estratégicos.
Identificar ministério, identificar organizações, identificar atores na qual podem nos ajudar a moldar a política, a mudar políticas ou a criar mudanças substancial e consistente.
Engaging, having that meaningful discussions, conversations with decision makers and policymakers, it really played a vital role in shaping our advocacy work.
Desde que eu iniciei com ativismo, mudou muito, o movimento ficou mais fortalecido, as ações são feitas por pessoas LGBTQIA+, para elas mesmas, acima de tudo.
We have assimilated into state processes that we never thought were possible before. That's progress that we did not think was possible.
Participamos de processos de consultas nacionais para reformas legais.
We are able to hold certain public institutions accountable.
We are also now in a point whereby even the policymakers, they now have another perspective of how they actually viewed issues of gender.
We're having more supportive parents, we're having more supportive church members, more supportive lecturers who are actually curious and would want to know how they can support us and also how they can change their perspectives.
São muitas lições aprendidas, mas uma das principais foi trabalhar em rede. Nós percebemos que qualquer processo de mudança pressupõe trabalho conjunto e coordenado.
I think I've learned to understand that consistent advocacy is essential.
The lesson that I've learned and what needs to be sustained: curiosity. If you're not curious about other people, you're not curious about the work that you're doing, I feel like you're always going to be stagnant. So I think as long as you continue to be curious, especially with what the younger kids want now, to make sure that the world that they grow in is even better than the one that I'm growing in.
At the end of the day, advocacy, it's a long game. Continue holding that light until you pass it on to another person. There's another generation that will be inspired, that wants these rights, and we want to live in a world where everybody can be who they are, love who they want to love, live the way they want to live, get access to life-saving medication and prevention tools.
No one can better advocate or speak about our issues better than us. nothing can stop us. We have to actually go forward and make sure that we also work on the change that we want to see.